I think there's probably a gap of knowledge for a lot of the listeners out here today about exactly what direct primary care is. We know what primary care is, I think, in general, and we think about going to our general practitioner and seeking care, nurse practitioners, PAs, and such in that world. The dynamic of change between the fee-for-service world or hospital-owned direct primary or hospital-owned primary care practices is there's insurance is heavily involved, right? And in direct primary care, what stands out are not only the fact that it doesn't bill insurance, but that it is time spent with the provider. It's availability and accessibility to the provider, but more importantly, affordability for most people. So affordability and accessibility are the two things that really are the roadblocks to healthcare. And direct primary care seeks to solve that by giving people access to care when they need it at a cost that they can afford. And we do that for individuals. We do it for companies, large and small. Our niche has been working with the small business market, and Thrive fits right within that range. And primarily, what we found was a lot of small businesses were giving healthcare options that were just not up to the standards of what the large companies were given. And that's in the healthcare plan designs and things of that nature. So what direct primary care seeks to do is to drive down costs on the insurance spend by offsetting some of those costs within a clinic. And what I mean by that is you invest in the clinic model by paying a monthly access fee, and those things happen in the clinic don't hit your insurance claims history. And then therefore that starts to give an ROI back to the claims history and back to the client per se. But more importantly, what we're also doing is for the employee, and Ryan can speak to this highly. I'm assuming you will. The employees now have access to healthcare. It doesn't cost them when they go. There's not a copay when they go. They can get in relatively quickly within a day or two. 0 to 5, 10-minute wait times. But most importantly, they get to spend time with their provider. That's the difference, Brian, that sets direct primary care apart from the normal fee-for-service doctor. The fee-for-service doctors are typically seen anywhere, and Brian, you can check this out, I think anywhere from 3,500 to 4,000 patients on our patient panel. And we're looking at anywhere from 600 to 1,200 typically in a direct primary care practice. So think about gym memberships. For those that still aren't quite sure what this is, you pay a monthly fee, you get access to the gym. You can use the gym for lifting weights, for tanning, for massage or whatever it may be. But you're still paying a monthly fee, and you get to use the services that are within the gym. Whether you use it or not, you're paying a monthly fee. And that's to the benefit of the gym. The less you use it, you're not turning their equipment up. In the primary care world, of direct primary care, we flip that on its head. We simply say, you're paying a small monthly fee, but we want you to use our care. We want you to come and get taken care of. We want you to know that it's accessible. We want you to work on your healthcare journey. Not just now, but long term. And we're bringing in people into this clinic that have major issues, health issues, some that have no health issues at all, but it's a place to come in and to find where you're at in your healthcare journey, and then to have someone that's wanting to spend time with you and has the time to spend with you because they're not encumbered by insurance regulations, insurance billing, and other things that typically would apply to your normal doctor or fee-for-service doctor. So, with that said, there's so much more to talk about. I'm sure we'll dig into it later. Direct primary care, thinking about a gym membership, concierge medicine. We're going to take care of the patient, get them in when you need to be seen, and not charge them exorbitant cost. And this is the same amongst all direct primary cares. They all have their different nuances about some receiving medications included in membership, some having labs included in membership. They don't all do that, but some do. So there are nuances to that. So I always say, always check with your direct primary care to see what they offer.